Certain minority communities in Monroe County are getting hit harder by the COVID-19 virus than white people. African American and Hispanic communities have been hospitalized at a much higher rate than other groups. Members of the black community specifically are sent to the ICU at 3 times the rate. However, Monroe County Health Commissioner Dr. Michael Mendoza says deaths from COVID-19 are coming in at roughly the same percentage racially as the population breakdown. Kayla Green was part of a virtual press conference with him earlier and provides some insight into this new information.
Dr. Mendoza says he still wants to look at factors like age and geographic location to figure out exactly what's going on. But he says at this point he believes people of color don't have the same level of access to health care and are seeking care later. According to Dr. Mendoza, people of color are 2 times more likely to be hospitalized for COVID-19. ICU numbers are even higher in some cases, with 53.8% of patients in the ICU being black. That's 3 times their population rate in Monroe County of 16.2%. Hispanics make up 9% of the population and make up 5% of ICU hospitalizations. The COVID-19 death rate, however, is nearly parallel to the minority group population rate. Dr. Mendoza says being hospitalized for COVID-19 often directly relates to how long it takes to access care.
To try to understand how can we identify people in minority communities earlier in the course of their illness. If getting infected is perhaps something that's less able to be amenable to prevention, can we at least prevent people from presenting later in their illness? Can we help them to access care earlier? Can we test them a little earlier?
Dr. Mendoza also addressed why the county doesn't report race and ethnicity with test results. He says at this point they don't have that data. He says race and ethnicity is often left blank and it would have to be entered manually. He says the county is working on a way to report that information. In Rochester, Kayla Green, News 8.
All right, Kayla, thank you. Dr. Mendoza also says he anticipated seeing these disparities. He says that there are certain zip codes that he's been looking at throughout this process.